Thank you for tuning in to TalkWad.com, the world's fastest growing internet radio network. Please check out all the other great shows on www.talkwad.com.
What if your customers are trying to find your business online, but instead of finding you, they find your competitors? Now, more than ever, it's time to make sure you have the right SEO to make your business stand out online. Welcome to Go Mind Your Business with Terry Bork, presented by Extreme Marketing Concepts, putting your business in front of the hungry herd of buyers who are looking for you right now. Extreme Marketing Concepts, helping you drive more traffic, dominate the market, and crush your competition. And now, here's Terry.
Hello, everybody. Welcome to another edition of Go Mind Your Business. My name is Terry Bork with Extreme Marketing Concepts, and it's my pleasure to have all of you joining us today. My very special guest today is Dr. Vivian DeLuca of Impeccable Smiles, Dentistry. Dr. DeLuca, welcome to our program today.
Thank you, Terry.
Oh, it's so great to have you on our show.
Happy to be here.
Yeah. So I know me and a lot of our listeners have many questions for dentists, and I'm so glad that we have this opportunity to maybe to dispel some myths and to learn some stuff that we may not already know. And I'm excited to share all of that with our listeners today. It'll be great.
Excellent.
But before we get started, let me share with you a little bit about Dr. DeLuca. Dr. DeLuca's office is located over by St. Joe's Hospital North. She's located at 4945 Van Dyke Road up in Lutz. And her number is 813-365-3552. And her mission is to provide comprehensive dental care with the best quality available in a modern state-of-the-art facility, which is absolutely beautiful.
Thank you, Terry.
And to improve the overall health of her patients to a beautiful, healthy smile and a positive dental experience, which is great. And if you are a chicken like myself, I can promise you that you have no fear when Dr. Vivian is here, because she can just take all fear from you and put it aside and help you relax and be comfortable in the dental chair, no matter how basic your procedure. Dr. Vivian has a BA in Fine Art that she got up at Ohio State University, and she graduated cum laude. And then she went on to the University of Florida College of Dentistry. She also joined the U.S. Navy Dental Corps, in 2001?
Yes.
And served in Okinawa, Japan. She received a fellowship in the Academy of General Dentistry in 2007, and she earned her fellowship in American Dental Implants back in 2009. She does continue to go and obtain continuing education credits and has many professional memberships throughout the Carrollwood area and all over the country, too, from what I understand. And she's very well versed in aesthetic dentistry, braces. She does a dental boot camp. She does endodontics, implants, all sorts of things, root canals, all sorts of things that you might need for your dental and oral hygiene. So again, welcome, Dr. Vivian, to our program.
Thank you, Terry.
Yeah. So let's talk about the toothbrush, okay? Is an electric toothbrush better for you than a regular toothbrush, and are they safe for your children?
Basically, you'll get tired much faster than any electric toothbrush will get.
Mm-hmm.
So you're going to find that you do clean much better in a much shorter period of time.
Mm-hmm.
Many of my patients ask, are they safe for my children?
Yeah.
They're wonderful for children, especially in the 10 to 20 years where they're still working on their ambidextrous skills, their hand skills, and they don't necessarily manipulate a manual toothbrush effectively enough.
Okay.
A manual toothbrush or an electric toothbrush will do such a better job for this age group.
Right. And now for your kids, doesn't the electric toothbrushes automatically turn off so kids know when to stop?
This is true. And they're also sized more appropriately for smaller mouths.
Mm-hmm.
The toothbrush bristles are gentler. They're designed to fit a child, fit into the areas that they tend to miss more frequently. So many are available, but I would definitely size the toothbrush for the appropriate age group.
Got it. Okay. And a big question, I think, for adults, soft, medium, or hard bristle?
Always soft. Very, very important. You always want to use soft bristles, especially for those who really are aggressive cleaners. You can actually polish the enamel off of your root surfaces and cause damage by brushing too aggressively. So always a soft bristle. If you don't feel you're getting enough clean, we'll talk a little bit later of actually brushing with Listerine, and that's going to meet all of your needs in the way of actually getting a nice smooth tooth surface.
Got it. Okay, great. You know, for us moms out there, a lot of concern. When is it right for you to bring your child to the dentist for their very first checkup?
As a general rule, if they have teeth, they're ready to be seen.
Okay, so it could be 9 months.
Well, yeah. If you're starting to get something coming in at 9 months that concerns you, sometimes a tooth come in and it'll already be damaged. Mother will have concerns. Or if a child falls, if you have a toddler that lands mouth first into a corner cabinet, have a dentist take a look, because it is possible, and it frequently happens, that the baby teeth are actually jammed up into the mouth, into the developing tooth buds of the adult teeth.
Ooh.
And so if with early intervention we can reposition those baby teeth, you can save future damage on adult teeth that you're not looking to see for another 6 years.
Right.
So if there is a fall, just take the child into the dentist just for a quick look. Myself, we offer free exams, free visual exams for all children under the age of 3 as an encouragement. If you got a question, bring them in. Just takes me a few minutes to potentially save you a lot of money down the line. So.
I got that. Okay, great. You know, the big question I have, we're hanging out in the dentist's office twice a year, or we're supposed to be hanging out, getting our cleaning. What's the difference between a healthy mouth cleaning and a deep cleaning for perio maintenance?
That's a question that we get a lot. A healthy mouth cleaning is like the cleaning that you get as a kid. The hygienist removes the soft, sticky plaque and stain, and then she polishes your teeth. As an adult, we have more issues with that plaque becoming hard calculus, especially if you haven't seen a dentist for anywhere from 3 to 30 years, which is actually my practice average. That sticky plaque really gets very tenacious and very hard. A routine healthy mouth cleaning is not going to get any of that off. All that's going to do is polish the crap. And so we actually do what's called perio maintenance, which we have to use a Cavitron or a scaler to actually remove those hard deposits in addition to the plaque, so that we can actually get to the enamel to polish it. If it's been more years than not since you've seen a dentist, that hard calculus actually begins to collect and form below the gums all over the root surfaces. And the longer you wait, the more periodontal disease that you get. The more root surfaces are exposed, that hard tenacious calculus takes even longer to remove. So we may elect to make sure that we get you numb first, so that we're able to not leave no man behind, as they say in the service. But it's important for us to get all of that out, because that's where the bugs harbor. The more of the calculus you have down there, I call that high-end condo for the bacteria that's eating away at your bone. So we need to get the housing out of there, so that you stop experiencing the bone loss.
Okay, I totally got that. And again, for us folks that are a little not comfortable hanging out in the dentist chair, you're able to offer some sort of sedation process or a relaxation process for us, so that we're not as chicken in the chair.
You're not dreading the visit.
Right.
Yes.
And I know, and I can share from experience, all of you, I am chicken, and they expect you to be a chicken in the chair. So it's okay to be as chicken as you want to be, because they can handle me. They can handle you.
Most of our patients have some level of fear. So we offer a wide variety of comforts to help ease, from light Valium sedation, just to kind of take the edge off.
Right.
We can do oral sedation for smaller procedures, and certainly for children. The nitrous works wonders. I have many of my patients who, even for their regular cleanings, they want the full Monty. They want to be. They don't want to remember it. They want to be down, and so we accommodate to your wishes.
Got it.
So,
okay,
something
that's
for all
fabulous.
sizes.
Yeah. Oh, absolutely. Cool. Now, there are so many insurance plans that are out there, and a lot of them only give you 2 dental cleanings a year. Is that enough, or should people get more?
Again, it depends upon the level of periodontal disease that you've acquired over the years. Insurance policies were set up 45 years ago, and unfortunately they have not kept up with the times. They've not kept up with new procedures. They still currently, most of them do not pay or do not provide any benefit at all for implants. Some of them really don't provide much compensation for the deep periodontal cleanings. So they've not stayed up with the times. They have also not increased their benefits with the cost of living increases. And so the benefit that was originally offered 45 years ago, which really covered most of your needs, covers very little now. So insurance companies really aren't geared toward what you need or what might benefit you. It's really based on what's going to cost them the less money. So you have to keep that in mind. They're not there to help you out. They're there to look for reasons to not cover what you need.
Yeah, and it's so difficult to understand dental insurance anyway with what's covered. What's the best way for people to handle that? Say, are they sitting down with the ladies at the front desk and understanding the procedures so they know how to talk to the insurance companies?
In many cases, for us, that winds up being a team effort.
Okay.
Because insurance used to be a very straightforward thing. Basic 80-20, you paid your 20, they paid the 80. Everything was fairly straightforward. If it was major, it was 50-50. That whole insurance process has devolved, in my opinion. They are deliberately ambiguous. Plans are no longer consistent from one to another. You have your HMOs, your DMHOs, your PPOs, and it's very complicated for us to find out the benefits and almost impossible for the patients to find out. So we tend to tag team. The insurance companies are willing to give the patients the information, but the problem is the patients don't know how to ask the questions.
Right.
Frequently we call and we're flat out told, oh, we can't tell you that.
Right.
And I'm like, why? This patient's here, they need this, is it covered? Oh, we can't tell you that. So we've had to put the patient on the phone, guide them what questions to ask. This is what you're going to hear, so this is the question you need to ask next.
Right.
And frequently we'll ask for written copies of the benefit plan. And again, we'll get the first 3 pages. Well, the other 4 pages are the list of exceptions.
Right.
So on page 3, it says you're covered for deep periodontal therapy. On page 7, it says, oh, no, but you're not.
Right.
Okay, and so
that's not helpful.
The patients will get mad at us, when they call the insurance company and they'll ask, am I covered for deep periodontal cleaning?
Right.
And they'll say, oh, of course.
Right.
And they didn't bother to ask the deeper questions because they didn't know. That would have obtained them the truth, which is, oh, on page 7, that excludes you. So sorry.
Right.
But they won't offer that to the patient, and the patient won't know to ask. They hear, sure, of course you're covered, and they're happy.
Right.
And they're very unhappy when they get the bill and they find out, oh, no, you didn't read page 7 where it included the exceptions that excludes you, so it's all yours.
Got it. Okay, great. X-rays, what's a panoramic X-ray? And why do you need those?
A panoramic X-ray is one of several sources that we have to choose from, and the X-rays that we take is really based upon what we need to obtain from them. A panoramic X-ray is a large X-ray that basically encircles your head, so we don't have to put the X-ray film in your mouth. Patients really do appreciate that, especially the smaller children where the sensor is technically a little big for their mouths.
Right.
It gives us a lot of information, especially the new digital versions, which is what I have in my office. The level of detail is just phenomenal. I'm able to see their temporomandibular joints. I'm able to see if somebody's been in a car accident, if they've actually fractured the bones that support the eye, I can actually see that. If they fractured their jaw, I can see that. If they have early or moderate, and even in some cases, end-stage cancer of the bone, it's painless. You have no clue it's there unless the bone begins to expand and raise your curiosity. So we're able to detect bone cancer for children who are growing and they have what we call mixed dentition. They have some of their baby teeth, they have some of their adult teeth in, and we're trying to gauge how well are they growing. Are they a slow grower? Are they ahead of the game? Do we need to send them to an orthodontist maybe early for an evaluation to help expand some bone so that their adult teeth can come in? That's appropriate for the late growers. But we were able to see and foresee a great deal more things. For periodontal disease, a panoramic film really isn't appropriate for diagnosis. It's not enough localized detail. So for that, we take a full mouth series of x-rays or vertical bite wings, or what we call them, to more accurately measure how much bone have you lost.
Okay, great. Yeah, bone loss, that's kind of scary stuff too. What does that mean, bone loss?
Bone loss, your teeth are held into your skull by your mandible, your jaw. And as you age, as periodontal disease kicks in, and actually 80% of the population of adults has some level of periodontal disease. And most don't realize that. It's a painless, I call it the silent killer. You don't know that you've got it, or it doesn't hurt you until you get the pill, until you find out how severe it is.
Right.
You know, you can look like you have nice, healthy teeth, and actually you can have healthy teeth and have actually lost 2/3 of the bone that supports your teeth and not know it until you've reached that far.
Okay.
I unfortunately see that weekly, where I'm having to prepare a patient who they really have nice teeth, and they come in because they haven't seen a dentist in about 12 or 15 years. Their teeth are starting to move. They're getting mobile, and they were concerned. But they've lost so much bone, we have to initiate the discussion of, you know, you're going to need to transition to dentures. And they're in shock. And had I seen them sooner, you know, we could have averted the progression of the disease and stopped the bone loss. And the bone loss is basically, this is a bacterial infection. The same bacteria that melts away the bone is the same bacteria that attacks the valves of your heart, that damages the other organs of your body. You've heard periodontal disease linked to premature delivery for pregnant women. It's now linked to pancreatic cancer, increasing the severity of Alzheimer's. So there are so many connections to your overall health where this bacteria isn't doing you any good. And unfortunately, again, because it's painless, people don't realize, and they just sort of assume this is just life. You know, my parents had it, I had it, you know, oh well. But what they don't realize, one, it is very controllable. What we inherit isn't the tendency for periodontal disease, is we've inherited the habits that have allowed that disease to progress.
Oh,
and so the habits can be changed, but I got to see you first to help you change them.
got it. Right. That really makes sense. You know, you can't see me, you can't fix me, right?
Exactly.
So again, I can take my little happy pill and be nicely
Yes.
calm, and you can do your probing. Or whatever it is that y'all call it. All right.
measure.
Yeah, your measurements. Yes, that's when you hear like, oh,
Measure
it's
the loss and
pockets
measure your
and
progress.
4 and 2 and
That's right.
1. And the lower the number, the better?
Yes, healthy
Okay.
gum tissue pockets, the little collar around the teeth should be anywhere from 1 to 3 millimeters. If you start hearing 4s, then you have some what we call gingivitis, and that's infection and inflammation of the gum tissue. And gingivitis is different from periodontal disease. You don't have so much inflammation, and you don't have pain usually, and it's just nibbling away at the bone.
Got it. Okay, great. So yes, I know these are all terms that you've heard. Oh, pocket 2.
Yep.
Teeth
2,
number
3,
3.
5, 6. Uh-oh.
Right. Okay. And that's when you're using that funky looking.
We have a little ruler. We have a small little
okay.
ruler. They call it the probe.
the probe.
Patients
Yes.
patients come in and they'll say, "I don't want to be probed." Not a problem. I will not probe you, but I'm just gonna do some measuring,
Got it.
and we can sedate you before we do that.
Okay, great. And it really doesn't hurt to have that done.
No, usually if it is uncomfortable, that's an early indication that okay, I guess I do have periodontal disease.
Okay.
Because in healthy tissue, it's not uncomfortable,
Right.
as you've experienced.
Right.
But when you have someone who has a lot of severe gingivitis or certainly more advanced periodontitis, we put that in, and it's going to be a little more uncomfortable. So
Okay.
that's going to be the patient's first
Judge.
clue. Okay, if that's a little sore, then I'm better brace myself. There's probably going to be some things I need to do.
Right. Okay, great. You know, fluoride, there's so many mixed reviews out there about fluoride. Is it good for you? Is it bad for you? Is it toxic? Why does the dentist want you to have toothpaste with fluoride? Why are they cleaning and giving you a fluoride treatment? Can you talk a little bit about that for me?
Fluoride so far is really the best way to actually remineralize and harden teeth. It is especially important in a child's developing years when they have their baby teeth and their adult teeth are still growing. It has a huge impact on how strong the enamel grows before the tooth is even erupted. For patients who have not had the benefits of that, as their adult teeth begin to erupt, I've had teeth when they fully erupt, already have cavities from that 1 year of being exposed and not being able to be reached, and they already have a cavity. For the patients who have been exposed to fluoride, they're much stronger. They have sealed more completely. They have some resistance to cavities in those early years, as they're still not yet ambidextrous enough to really get in there and clean. And it's so important. I have all of the teeth in my mouth because my generation was exposed to fluoride. Both of my parents had dentures by the time they were 20. Okay, a lot of periodontal issues that, again, they made a point for us to not inherit the habits that they had. They made a point to learn what habits we needed to employ so that we didn't lose our teeth in our 20s. So again, that wasn't inherited. It's the habits that we learn.
Got it.
But fluoride, again, you hear in the media, oh, it's toxic, it's bad for you, we need to take it out of the water supply. And here in Pinellas County, it was recently taken out and then recently put back in, thank goodness.
Okay.
It is so necessary for the impoverished portion of the population who don't have access to dental care. The parents they're frequently single family homes. The parents don't have the time to spend with the kids to make sure that they're brushing. The kids don't get the brushing education. At least they have some natural defense from the water supply. And as far as the toxicity, anything in too high a quantity is toxic. Fluoride is a mineral just like zinc, copper, oxygen. Oxygen can kill you if you're given pure oxygen. I don't know if people stop to think about that.
No.
It's something that's very necessary to life, just like we believe that fluoride is very necessary for the health and proper development of your teeth. But in too high quantities, there are going to be repercussions. I've never heard someone say so-and-so died of fluoride toxicity. Never heard of it.
Right.
If you do ingest too much fluoride, yes, you might get a tummy ache. You'll have maybe white spots develop on your teeth, but these are actually areas of the enamel that are extra strong. Not a bad compromise, but if that's the downside versus a mouthful of cavities and potentially dentures by the time I'm 30, I'll take that downside.
Right. Yeah. Oh, absolutely.
Does a body good.
Yeah. Right. Okay. Let's talk about mouthwash for a second. There's so many different kinds of mouthwash on the market, yet I hear, 4 out of 5 dentists recommend Listerine for their patients. Why Listerine so much? And, Listerine doesn't really taste that great. There's other brands out on the market that taste better. Are they as effective as Listerine? So maybe we can address all of that. So let's start with why Listerine, first of all.
For me, Listerine is my one of two choices, Listerine or hydrogen peroxide. I choose Listerine, and it's what I choose to use. It's actually something that I picked up when I worked in the Navy. You have the Marines going out into the field for 3 to 6 months at a pop, and unfortunately some of them don't bother to take a toothbrush. So they come back from their tour, and we have a limited number of weeks to get them dental ready to be deployed again. And they come back and they've been surviving on Mountain Dew, caffeine, high carbohydrate foods, which means the fillings that we put in a year ago are already starting to suffer, already starting to break down. And in a mouthful of blood and infection, I can't put in new fillings. So Listerine is what we used to really turn them around in a very short period of time and get their mouths healthy so that I could even put in and address the cavities that were there. So I was really impressed by how quickly it responded, how quickly it was effective. What I recommend is not just swishing with Listerine, but actually swish with it for 20 seconds, spit it out, but actually brush with it. Target right where the gums meet the teeth. Brush with the Listerine in those areas. It works like nothing else to remove that sticky, plaquey film that we're looking to remove in the first place. And if you use Listerine regularly, that plaque never really gets a chance to get hard and turn into the calculus. That requires more of a deeper cleaning. It really helps you to do the job.
Right.
It actually helps you brush in probably half the time.
Okay.
And you address the issue of flavor.
Right. There's the green ones that are out there. I don't want to say the names, but they're out there and they're yummy.
Yeah, some of them are very good tasting. You have to look at the sugar content, and you have to look at, is it as effective at doing the job? They all kill some bacteria. They all clean some. But I challenge you to do what I did, and I tested it out for a week. I cleaned with my Listerine first, and again, not just rinsing, but actually brushing with it. And then I tested some of the blue ones that really kind of tasted kind of good. But I noticed with those, it tastes sweet at first, but then they get kind of sour. And the blue stained my teeth this brownish color, and I couldn't get that off. I don't have the staining issues with Listerine at all. And Listerine has many flavors. They have a nice vanilla that's very nice and very delicate. You can certainly use the good old-fashioned bootstrap Listerine if you want to really be a diehard. But all of the other flavors clean just as well. One of the big surgeons was, it's got that bad alcohol in it.
Yeah.
It's going to give you cancer. It's not really alcohol. They're alcohol sugars. And it's those alcohol sugars that help to break down the plaque that you're trying to remove. And they have even included my second favorite, which is the peroxide, and that helps to whiten the teeth.
Right.
So for the patients who say, I'm just not willing to use anything with alcohol, in some cases it's for religious reasons, I suggest the peroxide. It doesn't clean quite as well, but it's an excellent bacteria killer. It whitens nicely, and the improvement in the gum tissue is excellent. It really helps to draw out the inflammation from gingivitis, really helps the gums heal themselves. So those are my two favorites, and I have found that they simply help me to do my job as a brusher, and certainly my job as a dentist much better.
That's awesome. Okay, and excellent tips. And so you can get the Listerine and not be getting the one maybe that's a little harsh. There's some other varieties that are available, so you don't have to do something so difficult. You can lighten it up a little bit. That vanilla actually sounds kind of nice.
Vanilla is very good, and they have like an orange popsicle that's great for kids.
Oh yeah,
that's the one that kids really like, and they're milder. They even have the Listerine Zero now that also has no alcohol. And I was a little concerned at first when that came out that it might inhibit the cleaning properties. I have been very pleasantly surprised. I've not found that. So I use the Listerine Zero frequently. And I like the purple one because it also includes extra fluoride. Of the rinses that are out on the market, you also hear about Act Fluoride, which is very good. You can still use your Act Fluoride to add fluoride after the fact, or you can simply select the Listerine that has the benefits of the peroxide and the fluoride.
Got it.
And that's the purple one.
That's the purple one. Okay, perfect. We're speaking with Dr. Vivian DeLuca of Impeccable Smiles. If you have any questions, the office is happy to take them. You can reach the office at 813-365-3552. Dr. Vivian also has a very comprehensive website where you can go and get some of your dental questions answered. You can also make appointments online or just find out some more general information about their practice. You'll find that at www.impeccablesmiles.com. You are listening to Go Mind Your Business here down at the Talk WAD Network. If you're looking to have a press conference for your business, give us a call at 813-863-1452, and we're happy to set that up for you. We're going to take a quick break from our sponsor, Extreme Marketing Concepts, and we'll be right back to Go Mind Your Business after this brief message. We are back here at Go Mind Your Business. My name is Terry Bork. You know, a lot of businesses today have one of two problems. Their business has a really great reputation and nobody knows about it, or they've got a terrible reputation and everybody knows about it, and we can help you with either one of those situations. Give us a call at 813-863-1452. 1452. Again, my guest today, Dr. Vivian DeLuca with Impeccable Smiles up in Lutz near St. Joseph's Hospital. Give them a call at 813-365-3552 or visit their website at www.impeccablesmiles.com. We're going to come back again to Dr. Vivian DeLuca. Welcome back, Dr. DeLuca.
Thank you, Terry.
Okay, great. Let's talk about periodontal disease. Such a big word. What does it mean?
What it means basically is you have a bone-eating infection. It's bacterial in nature. 80% of adults have some level of periodontal disease, and many of them have no idea. Again, because it's a painless situation until it reaches the advanced stages, or you hear the bad news. I try to catch the news a little early, but again, sometimes on average, I'll see a patient who hasn't seen a dentist anywhere from 7 to 30 years. So we do our best with what we start with, and we help you make the best of what you have.
I got that. Okay, so you'll fix what you can,
Yep.
even if you didn't break it.
Exactly. Like I
good.
said, I call it the silent killer, and it's a bacterial infection that eats away at the bone that supports the teeth. And once you lose a percentage of the bone, the teeth begin to get loose, and in some cases will actually begin to fall out on their own.
Okay, great. You know, a lot of people talk about bad teeth, soft teeth or brittle teeth or just bad teeth running in the family. Is it worth it to still have them cleaned, knowing that dentures will probably be what's going to be in store? Or is that like a myth? Can you
There really isn't something, with rare exception, this is, I've inherited bad teeth. There are a few genetic diseases where you are born with no enamel. And for those patients, and there are very few, they have a good reason, a valid reason to say, I have bad teeth. I'm going to wind up in dentures. But for the most part, I find what they've really inherited is the doom and gloom of, I'm going to be in dentures. They develop the habits, or they adopt the habits that they've seen from their parents, and those habits are the attitude habits of, why bother cleaning them? I'm going to get dentures anyway. They inherit the constant sipping of the soda, which leads to rapid cavities, advancement of periodontitis. Many begin to suck on lemons, and unfortunately that will eat away at the enamel. I have a patient now who's all of 29 years old, but most of the enamel damage he did to his teeth before he was 18. And at 29, we're having to crown every single tooth in his head.
Wow, okay. Oh, that's not just pleasant to
No.
crown them. I mean, it's fine, but it's just not a pleasant experience because then
Yes.
you're grinding and doing all sorts of other stuff with your...
So for those who think they have bad teeth and think that there's no hope, there really is hope.
Okay.
We show you ways for you to make the changes necessary, and they really aren't too difficult for you to turn that option around for yourself.
Okay.
It's how you clean. Again, the Listerine is one of my biggest tools. Learning what to drink and when. In the hot Florida summers where everybody's got to be drinking constantly, what I see them sipping on is sweet tea.
Yeah.
That's basically cavity in a glass.
Okay.
Mountain Dew, cavity in a can. Root canal in a can is what I call that.
Okay.
Root canal in a can. You keep drinking them as often as you want, and that's what you're going to get, a mouthful of root canals.
Mouthful of root canals.
And it's not that you can't have the things that you want to drink. It's that you simply drink them differently. You drink it like a meal. You have it all down in about 10 minutes, and then you go back to sipping something that's sugar and carbohydrate free.
Okay.
And it's a very simple change that'll save your teeth.
Oh, okay. Really great advice there. You heard it from Dr. Viv first. Let's talk really quickly for a minute. I know you got your really special toothbrush with you and some teeth. Can you show us what's really the proper way on brushing for folks that maybe they can see? Maybe we can use your big tooth or something just real kind of quick. You got some big teeth. She's got some really cool teeth hanging out over here on the side. It's really kind of funky.
Alrighty, here are the real big ones.
Okay, we're going to have to hold that up higher
Not a problem.
because we want to get it up there.
Here you go.
Okay.
Many times people will close their teeth together and brush the upper teeth and the lower teeth at the same time. Bad idea.
Okay.
And unfortunately, that's very popular. And they think they're in there really brushing good, and they're getting the edges really super white. They're missing the most important part of their teeth.
Which is where?
And that's right where the teeth meet the gums. Right where the teeth meet the gums.
Okay.
And again, I'll advise people to rinse with the Listerine, spit it out, put some in a cup. They're going to dip their toothbrush in the Listerine, and I want you to target right where the gums meet the teeth.
Okay.
And I find if you do that, yes, your teeth will get clean, but also the most important part, the gums and the root surface, will get clean as well.
Okay.
That's where the plaque is accumulating. That's where the bacteria grow. That's where that sticky film turns into that hard calculus that requires a more expensive, deeper cleaning.
Okay, I got that. Now, you keep referencing brush those teeth with Listerine. Are we not using toothpaste anymore?
You use toothpaste after. I find toothpaste is wonderful at delivering the fluoride that strengthens the weakened enamel, but I find Listerine is a much better cleanser.
Okay.
And I'm a trained professional. When I brush with this toothpaste, everything feels smooth, even the goobers. I compare that with the Listerine, and again, I tested with different mouthwashes, and I find when I brush with the Listerine, after I rinse it out, I can feel where I've missed. I can feel what's nice and smooth and clean, and I can feel where I've missed, and I find I'm missing the same places repeatedly, and most people are, and that's where the cavities will tend to occur. So as patients become aware of this technique, they become better graders of their own technique. They become better brushers.
Right.
They get it. Then you floss after that, and you use your toothpaste once things are nice and clean so that fluoride can seep into that weakened enamel, and you can actually reverse cavities. I have patients who haven't seen a dentist in 7 years. They come in, and they've got some that have worked their way into the dentin, and we have to fill them, but they got like 15 of these early cavities. If they learn to brush this way, where they're removing the sticky film off of the teeth, I can put them on for a short period of time a prescription grade fluoride, which is 5 times the strength, and we can actually reverse those early stage cavities and save them 15 more fillings.
Right. Wow. Okay.
And if protocol is followed, I've seen these go away in as little as 6 to 8 months. That's a lot of damage to undo.
Yeah. But it can be done relatively quickly. I mean, in the general scheme of things, that's really fast.
But you have to be diligent and consistent.
One visit to the next.
Yep.
Right. Okay,
It
great.
works.
Yeah. What's dry mouth, and why do people have that?
Dry mouth is one of the 3 biggest issues that I deal with. When I have a patient new to me in the chair, I look at what damage is there and what caused it. I find if I can fix the underlying cause, I feel more confident that I can restore the damage and not have it turn around and happen again. Certainly, decay in cavities is one. Gastric reflux is another, because the stomach acids will just melt away the protective enamel. I find dry mouth exacerbates that much further. And again, dry mouth is one of those things that you don't think of. And I have many patients who had no idea they had dry mouth until we began to show them some difference. And I'll explain that here in a little bit. But it's become the bottom line of a lot of my patients' problems. Again, when I really started to look at the prevalence of mild, moderate, and severe dry mouth, at first I thought, okay, maybe 40% of my patients had this issue. I actually conducted a dry mouth study in the office end of last year, and I was shocked to find that probably closer to 80% have some level. The 40% pertained to the most severe. Even at my level of awareness, I was missing a lot, and we've certainly raised the bar there, because when your mouth gets very dry, you're losing in your natural saliva, you have antibodies that protect you from cavities, that protect you from the bacteria that advances periodontal disease. And when you lose that protective property, it doesn't matter how much water you sip, it's not there. It doesn't matter what kind of saliva substitutes you're using. It's not helping to replace your own immune defense. It's your body's first line of immune defense, actually. And I've noticed that as I've been able to guide patients to why their mouth has gotten dry, help them to make improvements, their cavity risk has dramatically decreased.
Okay.
The main causes for dry mouth are natural aging, of course, anybody who's gone through cancer therapy, radiation therapy, but the biggest issue is all of the medications that people begin to take as they age. High blood pressure medications, antidepressants, anti-anxiety medications, hyperactivity medications have really elevated this dry mouth to be such an issue in my younger population. And they suddenly become cavity farms. They're like, I don't know what happened. I never used to have this problem. And in a year, they come in because they're starting to see cavities in their own mouth very quickly, and they're panicked. And then you look closer, and there's a lot more damage than they could see. And again, I ask what's changed. Medications. They started taking anti-anxiety medications, anti-hyperactives, and their mouths are drier than my 40-year-olds. Oh my God. And it's, again, a huge issue. periodontal disease escalates, rapid cavity formation. And in patients who on top of that have gastric reflux and the acids, the stomach acids, your natural saliva helps to dilute that. So their issues become much more extreme and the damage much more profound more rapidly. So it's become a very important issue to deal with.
Okay. Wow. Okay, great. So thank you for clearing that up for me. Wow, that's awesome. If you're pregnant, are we waiting to see the dentist until after the baby is born, or is it okay to go see a dentist while we are pregnant?
Much more important to see the dentist even if you're pregnant. If the dentist refuses, then I suggest pick another dentist, because uncontrolled periodontal disease will lead to premature birth, and that certainly can lead to death. In the first trimester is when dental procedures are a little more at risk. So anywhere between months 3 and 6, you're safe for most needs. If you do have a dental abscess, the pain and the stress from a dental abscess puts stress on the baby. So even though there might be, some contraindications and you don't necessarily want to, get a full mouth of x-rays, you want to address issues that cause pain. That can bring on early labor. So if you have a dental abscess, if you're in that kind of pain, get the pain treated. There are things that can be done.
Okay. Diabetes and teeth care. If you have diabetes, is it important to get your teeth cleaned more often?
Absolutely. Diabetes is an autoimmune disease where your body attacks itself. It reduces your body's natural response to infection. So you don't realize until much later in the stages of infection that you've got something going on. Your early alarm system is shut off. And it's very important for periodontal disease that's present to be controlled, because that's going to negatively affect your blood sugar. People who have diabetes who aren't getting their teeth cleaned regularly, I've often hear the doctors can't stabilize my diabetes and they're not sure why. We clear up the periodontal disease, we take out abscess teeth, and all of a sudden, wow, they're stable. They feel better.
Sure. Okay. No, that makes terrific sense. One of my problems has been I'm a grinder. I grind my teeth. And you wake up, you have such a tired jaw when you're sleeping. That happens, Is there, for folks out there who don't know, can you share some tips for grinders? What do you do for them?
Absolutely. Usually when you're grinding, it's the result of stress, and you're not aware of how much of the time you're squeezing your teeth together. Often, a patient will present, and I can see a lot of enamel damage or other signs that they're a pretty heavy loader, and they're like, "Oh, I don't do that. I don't do that." And then you start touching the muscles and like, "Oh, that hurts. And so I know they're doing it. Their teeth are telling me they're doing it.
Right.
A lot of it is one awareness. I'll usually train them to conduct a little test through the day. Usually this comes from stress. Pick the top 10 things that tend to make you stressed. Make a list. Whenever you see, whether it's a boss, a kid, an assignment that you have looming, whenever you come into contact with that stressor, ask yourself, where are my teeth? Are they apart? Are they together? Or are they together and squeezing? This will raise your level of awareness and help you to retrain autopilot. Usually that's enough for probably 60% of the population. For those who really just can't take the foot off the gas, an appliance that they can wear either at night or by day, or one that they can wear, either way, can be applied to help take the pressure off the teeth. Because frequently, if they're squeezing a lot, they're actually also flexing and damaging and breaking teeth. So this will actually protect the teeth, take the load off the muscles, so that your muscles get to sleep when you're sleeping.
Oh, isn't that nice?
That's why your face is waking up exhausted. You've had it working overtime all night long.
Yeah, that happens. So and there's fixes for that, folks. So you don't have to, have that face
face pain
clench, anymore. To pull or not to pull to get the root canal or to put in the implant. What's the best procedure for the patient?
That really depends. If they've got a nice healthy root and a savable tooth, it's my opinion, always go natural. If you can keep a natural tooth, it's always going to be your best bet, because you have the ligament that holds that in, and it's a better situation. For those who have short roots and a lot of decay and it's not really a lot to save, maybe taking out the tooth and placing an implant is a better option for that patient. Discuss with your dentist the pros and cons of both options, and they can really help guide you to making a better choice.
Right. Okay. Perfect. Okay, we are almost finished and almost ready to wrap it up, Vivian. Is there anything maybe that we didn't talk about that you'd like to touch on today?
Well, we did talk a little bit about the gastric reflux, and again, that's one of my 3 biggies because I see such damage to the teeth, and people have no idea they have gastric reflux.
Right.
And basically the stomach acids will begin to melt the enamel off of your molars. It'll then move to the premolars, and then you'll start getting wear on the inside of the front teeth. Patients usually don't know it until most of the enamel's gone on the back teeth, and it starts to affect the front.
Right.
By that point, they're looking at a lot of reconstruction.
Okay.
So again, I try to alert early if I see damage to the back teeth. Especially in conjunction with a grinder, the damage just kind of escalates more quickly.
Right. Okay.
And as far as any other issues, I think we've touched on most of them.
Okay. Great. Yep. Okay. Great. So if you are chicken, or not a chicken, it doesn't matter either way. You can still be a person and be a chicken. You're going to feel the love from Dr. Vivian's office. They really want to make sure that you're comfortable in the chair. They will take care of you. They will hold your hand and just give you the best dental experience that you could ever imagine. And they're okay with that. You don't have to feel awkward or weird about it. Trust me, I know, because even I feel comfortable enough. And I was very afraid to sit in her chair. And she will tell you that it's actually not so bad to sit in that chair, and she actually makes me feel confident in myself. So you will get that from their office as well. Whether you're awake or you're sleeping through it or you're pleasantly numbed throughout any procedure that they do, so many options available to you from her office. Again, really easy to find them. They're right next to St. Joe's North, up at 4945 Van Dyke Road up in Lutz. If you have questions for them, the staff is very, very knowledgeable. And if they don't know, Dr. Vivian usually does. And their phone number, 813-365-3552. And again, their website is very comprehensive. You can find lots of questions that get answered on that website or any forms that you might need. Visit www.impeccablesmiles.com. Dr. Vivian, I really appreciate you stopping by and having a conversation with us today. It was so great to have you.
Happy to be here.
Yeah, it was wonderful. Again, Dr. Vivian DeLuca, everybody. You've been listening to Go Mind Your Business down here at the TalkWad Studios. If you're looking for a press conference for your business, give us a call at 813-863-1452. Today's show has been sponsored by Extreme Marketing Concepts, putting your business in front of the hungry herd of buyers who are looking for your business right now. Would like to thank you all for joining us today. And until next time, I remind you to go mind your business. Have a great day.
Thank you for listening to Go Mind Your Business with Terry Bork, presented by Extreme Marketing Concepts. If you want to drive more traffic, dominate the market, and crush your competition, find out how by visiting our website, www.extrememarketingconcepts.com. And join Terry next time for another episode of Go Mind Your Business.